Hi, everybody. Here I am, tucked under this guy's boil. Cool. Um, Here we are. I'm in section 16.3. And what I'm doing is I just wanted to talk about a couple of diseases that are listed by the CDC under diseases we should be concerned about due to antibiotic resistance. This is one that you're going to hear about in clinical settings frequently, and it's listed by the CDC under serious. So I said, what's the MRSA? What's the status of it? It's urgent are the first most concerning diseases for antibiotic resistance. We have serious and then concerning. So MRSA is considered under serious. So this is a big deal. And the this disease is talked about in section 16.3 of your book. And there's a section called the highlight disease, and it gives you a lot of information there. But what we call it MRSA, and what MRSA stands for is methicillin-resistant Staphylococcus aureus. We've talked a little bit about Staphylococcus aureus here and there this semester, and this is when you hear somebody has a staph infection. It's almost always Staphylococcus aureus. Out of all the different species of Staphylococcus, Staphylococcus aureus is the most common pathogen. About 30% of us carry it with us. Like if you just swabbed your nasal cavity, 30% of us would have Staph aureus, or even on your hands. So this is a organism that's around, and it's not necessarily making you sick. But here are some of the common things that you do see. The way staph makes you sick is it makes, sores like this, like infected sores, or rashes. Like this one's called impetigo, the little dots and these little pustule rashes. And here's a boil caused by Staphylococcus aureus. It can cause systemic infections too, but it causes a lot of these skin infections because you probably remember that Staphylococcus is typically a skin bacteria. But if it gets into some of the pores, or something's out of balance, it can cause these kinds of infections. And staph infections can be cured, but it becomes a bigger problem if you have strains that are methicillin resistant. So penicillin was developed, and then penicillin started becoming resistant Staphylococcus started becoming resistant to penicillin. So scientists developed methicillin, and then microbes started becoming resistant to methicillin. And we've developed vancomycin. There's some Staphylococcus is becoming resistant to that, and that's a real problem because that's kind of our last antibiotic to use for this. And so it says, explain the important features of this pathogen. And so you can see some of the kinds of infections that it causes, and that it's something that is becoming very antibiotic resistant. This is a table from your book, and I just wanted you to see some of the things about MRSA, methicillin-resistant Staph aureus. The most common mode of transmission is contact. So like we said, this is a skin organism. This is one of the reasons why you want to wash your hands when you're going between patient to patient. Or if you work in a clinical setting, you want to make sure even your clothes, you don't want to work with patients and then pick up your baby when you come home. You want to change your clothes because these bacteria can be on your clothes. If you have Staphylococcus as part of your normal microbiota, we said 30% of us have it, in our nasal cavity and on our skin. It doesn't mean you have methicillin resistant, but many of your patients are going to have methicillin-resistant Staph aureus, and it's not uncommon. So like I said, try to avoid contacting between patients if you know they have this, and avoid contact with your family members with your clothes. How do you prevent it? How do you prevent transfer of it? Mostly hygiene practices. A lot of the skin cleaning and all that we do for surgeries is to prevent staph infections. So hand hygiene, skin hygiene, those kinds of things are really important. There are different kinds of antibiotics, vancomycin, there's some other ones, and these that are the last resort for MRSA. Community-associated MRSA infections, most common in children and young to middle-aged adults. And the incidence is increasing in communities, meaning I knew of somebody who got MRSA just from shaving her legs. She got a nick and got MRSA. People get it all sorts of ways, but it's decreasing in hospitals because of our vigilance of being really careful and doing very high quality hygiene, hand hygiene and patient hygiene. But this is one you're going to continue to hear about. In section, I'm going to go to the next section, 21.4. And I wanted to talk about another pathogen in section 21.4. I wanted to talk about gonorrhea, and it's caused by Neisseria gonorrhea. List the signs and symptoms and possible complications. Most of you are aware that gonorrhea is a sexually transmitted disease, and this is an example of a poster made by the CDC, Centers for Disease Control. They have all sorts of stuff like this on their website. Really concise, well communicated information. And so they're showing you here that a lot of sexually transmitted diseases are actually going up in number of cases. Excuse me. Since 1914, and 19% increase in chlamydia, 71% increase in syphilis, 63% increase in gonorrhea. And so this is one of these diseases that, like I said, is becoming more common. And any of these sexually transmitted diseases, if you become infected with them, it actually increases your chance of also getting HIV. So, or long-term pelvic inflammatory diseases and abdominal pain and pregnancy complications. So any of these diseases is important, but antibiotic resistant gonorrhea is one of the three that is three diseases, not just sexually transmitted disease, three diseases at all that's in this urgent threat category. And so this is a really big deal, that we're getting to the point that drugs that used to kill and control these infections are having a hard time getting rid of them. And so what happens when you have gonorrhea? There's some pretty serious complications. I mean, a lot of it is just the normal sexually transmitted disease kinds of things, the burning when you're urinating, the pelvic pain, that kind of thing. But it can also interfere with pregnancy. And so here's an example of a normal female reproductive tract where there's the vagina, the uterus, the ovary where the egg pops out, goes into the fallopian tube, also called the uterine tube, gets fertilized in here, and then the fertilized egg will travel down the fallopian tube and embed itself into the uterus. Sometimes when someone gets gonorrhea, they actually get scar tissue. We can look up here. They get an infection in that fallopian tube and get scar tissue in there. And so what happens is they can get a fertilized embryo that's not able to move through the fallopian tube effectively and not able to embed into the uterus. And so what that's called an ectopic pregnancy. And that's incredibly painful, and it can completely destroy part of the reproductive tract here, and it can interfere with the potential of a woman to get pregnant again. It's a very potentially dangerous situation. So that can happen in somebody who gets gonorrhea. The other thing that can happen is a woman with gonorrhea can transfer it to a newly born infant and cause eye infections. And these eye infections, if left untreated, can lead to blindness. And these infections are preventable and treatable unless we can't treat the gonorrhea. So this is, again, a really big concern for antibiotic resistant organisms. And one of the best ways to prevent yourself from getting an STD is to practice safe sex. You and your partner get tested for sexually transmitted diseases and use protection barrier protection to prevent the transmission of sexually transmitted diseases, because some of these might eventually not be able to be cured. The last topic I want to talk about in this whole unit is in section 10.4. I'm back in chapter 10, and I wanted to talk to you about the concept of a super infection. And a super infection isn't a really big infection. What it actually means, it's an infection on top of an infection. So super meaning on top of, like a superintendent, or like your superior. An infection on top of an infection. So it says a super infection occurs when the use of antimicrobial drugs destroys good microorganisms. So you had some kind of infection, let's say a urinary tract infection. So you took an antibiotic, but that antibiotic had a relatively broad spectrum, and it not only killed the bacteria in your urinary tract infection, it killed other good microorganisms. And so what that's going to do is it's going to allow for the overgrowth of pathogens. So your good microbes aren't competing out bad ones anymore. Some of these bad microbes can grow, and that can be a totally different infection from what you were treated for in the first place. So the superinfection occurs as the result of the use of antibiotics. And some of the examples, I think a lot of people are familiar with the concept of vaginal yeast infections. The kind of yeast that causes most vaginal yeast infections is called Candida albicans. And remember, yeast is a fungus, right? And so what happens is a lot of times it's urinary tract infections, but it could be other things. Somebody takes an antibiotic, and the antibiotic actually kills some of the bacteria in the vagina. And there's a lot of this bacteria called lactobacillus. We mentioned this earlier this semester. There's a lot of bacteria called lactobacillus in the vagina. It makes a little bit of an acidic environment and prevents the overgrowth of Candida albicans. Most women will have Candida albicans in their vagina, but it's not a dominant organism. But if you get rid of lactobacillus, Candida can overgrow and cause the itching and redness and irritation that's caused by a vaginal yeast infection. So we would call that a superinfection, an infection on top of an infection. You had a urinary tract infection, you took an antibiotic, it reduced your number of good microbes and allowed Candida to overgrow. Thrush is another common superinfection. And here's an example of thrush where you have probably the same kind of yeast growing on the tongue. And this is an infant. It's more common in infants because infants don't have as much of a variety of microbes in their mouths as older people. And so they're more inclined to get thrush. So they might get it just from being exposed to the environment, but also if they take an antibiotic and you kill off good microbes, these yeast thrush might start growing. And you might find if a baby that's nursing gets thrush, that they keep picking up the microbes from the mother's breast. So the mother might also have to be treated for the thrush infection. But this would be called a superinfection. Finally, the last of the superinfections that if you work in a clinical setting, particularly in nursing homes, you're going to hear about this one. Clostridium difficile. It's called Clostridioides difficile. I don't know why I wrote Clostridium. That's the old name for it. Clostridioides difficile. You hear it called C. difficile or C. diff. C, capital C, period, D-I-F-F. But it's really bad diarrhea. And people get this. It's more common in older people because older people get a lot more antibiotics. A lot of antibiotic treatment happens in older people. They get an imbalance of microbes in their gut microbes, in their intestines. And this one starts to overgrow and causes this very serious diarrhea. And some people have a terrible time getting rid of this. And so this is a superinfection. It's an infection on top of an infection. You took an antibiotic, you depleted your good microbes, and ended up getting C. diff. Again, remember this organism makes endospores. So if you get this on your clothing, you can carry it home, or you can make it it can become part of your normal microbiota. I've had students tell me, that worked with patients with C. diff. They say it has a unique smell that you'll never mistake. And I've been fortunate enough not to have worked with it, but it's something that you will see in clinical settings if you work with populations of older patients. So all these are what we call super infections. And that's the end of this week's material.